Joining me on Doctor's Corner is Dr. Schamberger. He is a sports medicine specialist dealing with pelvic and spine alignment issues. He's also the author of Read My Hips, and he's here today to talk about alignment issues and how to treat, detect, and correct alignment issues. And he's here to talk about also his running. Were a former elite marathoner. And can you tell the viewers, I understand your fastest time was 2:20, is that correct?
2:20:09, that's right. And I've run 39 marathons. I ran through the 70s and 80s. No favorites, I run Vancouver Marathon 10 times, Boston 3 times. Boston's still my favorite. If you want crowd support, go to Boston.
And you won 4 marathons, is that correct?
I won Seattle, Calgary, BC Championship, and Birch Bay. I've been run-up in more marathons than I care to remember. 3 times in Vancouver. Those are the ones that hurt.
Yes, I'm so glad to have you here today and talk about
pleased to be here.
alignment issues. And tell us, well, I should ask you, what was the inspiration behind writing this book, Read My Hips?
Well, it all dates back to my running days. This was back in 1980. I went for a simple run in Stanley Park, 12 miles, which no problems, but at the end afterwards, I had heel pain in the right heel. It just persisted. I tried to get help over the next 70 years from medical people. Nobody really knew what it was. During those years, 82 to 87, I became more and more involved with groups that included meetings, chiropractors, osteopaths, physiotherapists, doing what's called manual therapy, looking at body alignment, something that had never been taught about in medical school. At a workshop in 1987, an osteopath looked at me and said, "Yeah, you're out of alignment, lie down on the table, push this way, pull that way," just like we've done. I just demonstrated. And then he told me, "You're in alignment, get off the table." I couldn't argue with him because my heel pain was gone. First time in 7 years. Got into my shoes and I felt like this, just one side up. And I realized I'd been provided a lift in the right shoe because they said my right leg was short. So I took the lift out and then I felt even, felt balanced. That evening I went for a 12-mile run in Montreal, and I'll never forget that for the first time in all those years, I came back feeling no pain, no muscle aching. Before, if I tried to run like that, my right leg would feel like it run a marathon. It'd be tired and achy, and the left one would be fine. That was all of a sudden gone. So I started to get very interested in what's this alignment business all about, and got into trying to figure out what changes when you go out of alignment. And this is the last 40 years of what I've been doing. I got to the point where I said, I need to get the word out to the medical people. So I wrote my first book, and it came out in 2002. It was well received by chiropractors, osteopaths, all the people doing manual therapy. I put out a second edition, 2013, and same thing happened. Just couldn't reach my colleagues. So I decided I'm going to write a layman's version, laypersons, because then I can reach anybody. You can read it, your nurse can read it, your physiotherapist. If they don't know about alignment, they can learn about it, because they're often the first ones that hear about your problems, and they can do a quick check and realize, yeah, maybe you're out of alignment, maybe that's what's causing a problem. Go and see somebody who can help you with it, that does manual therapy. So that's how this book came about.
Yes, I mean, is it like 80%?
The general population, there have been multiple studies, and they've all come out with 80 to 85%. Tragic thing is that even elementary grad students, 75% already the pelvis is out of alignment. So when the pelvis is not as crooked, there's one side higher than the other The legs are different length as a result, and so on. It sets up a lot of stresses, and over the years, these stresses can add up to eventually some structure becoming painful, some joint maybe deteriorating a little earlier than it should. Then you might feel pain, you might feel abnormal sensations until the alignment is corrected. Hopefully, that's the next step, and these symptoms will resolve again. And most people will respond to treatment.
I was like for runners and soccer players, I mean, it's different alignments, right? Different treatment, or how would you?
Well, anybody who's out of alignment, I recommend they learn how to do the self-assessment, or at least have a partner, a friend help them with it. Because if you are out of alignment, either you can learn to do something for yourself, like we did the self-correction maneuver, you could do that, or somebody helping you, like I did today, or go and see somebody you know who can treat you and put you back in. Because the sooner that happens, it decreases the chance of you developing pain or funny sensations and all the other things that come with being out of alignment. And the more you stay in alignment, the longer the intervals between going out of alignment. Eventually, like myself, I hardly ever go out of alignment now. I haven't had any back pain for years. That's all gone. I used to just think that was me, and it was the alignment that was the problem, and correcting that did away with it. It's definitely worthwhile learning about it, especially if you're into like a runner. That's probably they're most vulnerable. In running, only one foot is weight bearing. So all the forces are coming up through one leg. Now, if your foot is rolling inward on one side and outward on the other, setting up abnormal stresses, these stresses are just augmented by having to just land on one leg and then the other, and makes it more likely you're going to develop symptoms.
Yes, and one more question is like, I mean, once you know how to do it, like you can really tell, you listen to your body, well, I feel I'm out of alignment, I'm running a lot and I'm running on different terrain. So you have the key to, like, you know, to help yourself. But now if you're in line, like would you be checking your alignment in 3 months, or just depend? Like you should know the symptoms, right?
I check leg length. You can do the sitting lying test we did earlier. And that's a simple test. You can simply draw a mark across both feet like we did and see if there's movement, or have somebody eyeball it. If it's fine, good. You don't need to do anything. But if it isn't, then figure out which way am I out. Have I got an out flare, in flare, or have I got a rotation? And then do the appropriate self-correction for that, or seek help. Now, as far as running goes, being out of alignment obviously changes the whole biomechanics of the body, and you learn to adapt to being out of alignment. Your brain adapts to it, everything. It's like you've got a crooked brain now. It's used to you having curves in the spine and muscles tense on one side and relaxed on the other, and all these things that come with it. So what happens is it changes your style. I used to be known as the windmill.
The windmill?
Yeah, because when I was running, this arm was going forward and backward, like a normal motion, and this one did this maneuver. Put me in alignment, and they're both going the same direction. We see this in cyclists, in the legs, the most common way people go out of alignment. The right leg, when the leg comes upward, it moves away from the knee moves away from the crossbar. Going down, it moves in towards the crossbar. This one is just going up and down the way you expect it to. And the book, there's photos of that and typical motion. Now, in cyclists, for example, the leg that keeps going where the foot is rolling inward too far when they're pushing down, it actually loses about 5% of its strength. So it doesn't have the same, it can't generate the same force as the leg that is moving in the normal motion pattern. So it's costing the cyclists, it costs the runners. You end up with having to put out more energy to run at that same speed, to meet a certain speed, than if you were in alignment. So if you're running a marathon, that's going to add up to minutes, really wasting energy. So once you're in alignment, you're running efficiently, it's also going to reflect on your time.
The benefits.
That's right.
Yeah, so for more information, where can people go?
Well, my advice to somebody, say if I see someone who's out of alignment, I suggest see a physiotherapist who has training in manual therapy. That would be my first choice, because not only can they check your assessment, but they also have all the other things that physiotherapists do, ultrasound and heat and cold and so on, to help relax muscles that have been tensed up often for years because you're out of alignment for a long time. They can do all the other things, but they can also put you in alignment, and the combination, that's the winning combination, okay? Plus your involvement, they can instruct you in strengthening the core muscles and reestablishing stability of the pelvis and the spine by doing so. The other part of the treatment involves learning normal movement patterns. So they may refer you to someone who does Pilates, which is regaining normal movement patterns, efficiency. And so that's the basis of the treatment, is the realignment, normal movement patterns, reestablishing them, and core strengthening. Now, a lot of people, they have aches and pains and they'll go and try various treatments. Like you have pain over the iliotibial band and the muscle, the tensor fascia, say. You might get relief from an acupuncture treatment, but it'll only last so long, because if this problem is because your foot's rolling out and putting this whole complex under tension, it's just going to recur because you're still out of alignment. So a lot of these treatment techniques like acupuncture, intermuscular stimulation, IMS, a number of them, they'll help you, and they can be useful to combine with alignment, but on their own, they'll only give you temporary, maybe improvement, decrease your pain, decrease muscle spasm, but it won't last. So you need to tackle the problem that's causing it all.
Thank you very much for being a guest on the show. I'd like you to come back.
Thank you very much for having me. It's been a pleasure. And
Great information.
yeah.